वालेकुम उस्मान साहब।
वालेकुम अस्सलाम।
वेलकम।
इज एम ऑडिबल?
जी जी। जी आवाज आ रही है। वेलकम। आपको आज हमारा टॉपिक है HIMS का और उस्मान साहब हमें डिटेल बताएंगे। अभी तक 27 पार्टिसिपेंट्स आ चुके हैं सर, आप स्टार्ट करो।
ओके मैडम, जस्ट गिव मी 5 minutes. After that I will start.
जी जी, थैंक यू।
Okay, so I'm ready. Can you start now?
जी 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 सर। जी सर, स्टार्ट कीजिए।
Okay, okay. Let me share my screen first. Actually, this is urgent request, so I didn't prepare any presentation for that at this moment. but I can explain you in the details about the things that how's the hospital management system is working, why it is necessary for today's era, and what is the current status of our HMA system, and what our goals in the future, and what we are going to do. Sharing is not turned on. Madam, will you allow me to share my screen?
इसे शेयर करें सर.
नाउ कर दिया सर.
Okay. So is it visible to you guys?
No, sir.
Sir, it is visible in the screen, please.
Let me share it again.
Yes, sir, visible.
Visible. Okay, great. So is this visible to everyone?
सर म्यूट ऑल किया हुआ इसलिए वो नहीं बोल पा रहे सर.
All right. Okay. Okay. So first of all, my name is Usman Haider, uh, and I am the solution architect in the primary population health department. I'm working here from last 5 years. Before that, I was working with the private firms on the HMA system, and I have around 12 plus years of experience in the software engineering fields. And our today topic is about the HMA system, that why the HMA system is necessary, and where we are today in our development in that, and what are the characteristics of a good HMA system, challenges which we face during the implementation of the HMA system into the hospitals. So these are the topics which we are going to cover. Then after that, I will give you the demonstration of the HMA system as well, that how it is working in the practical field. So first of all, the introduction. I will ask the question at the end of each topic. We will cover that. So if you guys have any questions, you can ask me at that duration of time. Then we will move forward. So everybody is good, okay with that? You can just put the thumbs up sign. All right. Okay. So, introduction to hospital management information system. Uh, Why a hospital management information system? A hospital management system is an integrated software solution designed to automate, manage, and streamline the clinical, administrative, financial, and operational activities of a hospital or a healthcare organization. So, it is the answer of that why the hospital management system is necessary. Because if you are working in a hospital or you are owning a hospital and you have to manage all your resources, all your things, so by manually, it is not possible to operate a hospital in a very efficient and productive way. So for that, the HMA system is implemented in the hospital so that you can manage your expenses, and you can manage your employees, you can manage your complete HR recruiting process, you can manage the finance, the shares of the doctors, the share of the other people's, the profit margins, each and everything. So you will get the report at the end, and you will get the reports at the end of that. And by that reports, you can analysis on that, and you can improve your productivity, you can improve your revenue, you can make your expenses low. So that is the reasons that we use the software in the field. Plus, the main advantage of the HME system. So you have to manage the record of your patients. So if you have the record of your patients, you can check their history. Any doctor which is available at the moment can check the history of the patient, at what are the diagnoses, what medicines or what medication is given to that particular patient, and what are the reports, what are the results of that reports, and what are the things which are the allergic or the medicines by which the patient has allergy. So you can manage all that patient history. You can schedule the patient follow-ups. So these are the main things that why we are implement the HMAS system to control or the complete hospital organization. So it centralized patient information, hospital resources, medical record, billing, inventory, and reporting into a single digital platform, enabling healthcare providers to deliver efficient, accurate, and high quality patient care. So is that clear to you guys that why we use the HME system into the hospitals? Okay, great. All right. So the HMEs replaces traditional HMES replaces traditional paper-based process with digital workflows, reducing manual efforts, minimizing errors, improving data accuracy, and enhancing communication between the different hospital departments. So the purpose of this is as well, if we have one software implemented in our hospital and there is another software which is implemented in some private hospital and we want to share some data. So there are some international standards by which we can share the data between the two or the different hospital. So for example, if you are in the Pakistan and you want to share your patient data on the request of the patient to a hospital which is located in London or in USA, so you can share that data on the international standards as well. So there are the different standards, the HL7 standards, the FHIR2 standards. So on the basis of that standards, you can share your data with the other hospital systems. And by that, the doctor can diagnose their things. The doctor can see the history of the patients and what are the things they are involved in the journey of that problem. So these are the things that helps for the better treatment, the high quality patient care, and the accurate treatment to the patient. The system supports healthcare professionals, administrations, and management by providing real-time information for informed decision making and regularity compliance. So objectives of the HMAS is the primary objectives of the health hospital management information system are to improve the quality of the efficiency of patient care, digitize hospital operations and reduce paperwork, maintain complete electronic medical records, optimize utilization of hospital resources, enhance communication among departments, reduce operational costs and administrative overheads, improve patient satisfaction through faster service delivery, ensure compliance with healthcare regulation and standards, provide real-time dashboards and management reports for data-driven decision making. So these are the basic objectives of the HMAS, and in that there is one important point is the sport data-driven decision making. So with the passage of time, the medical field is evolving with the AI as well. So the data you are collecting on the HMAS system. So what we are going to do with that data is we are going to train our models on that data so that it will predict you by the reports of the patient or by the symptoms of the patient, and the system will intelligently and efficiently will tell the diagnosis or will tell the disease of the patient or can catch the disease before it will be happen with that patient with the past history of the patient and the past collected data on the basis of the past collected data. So this is the very important point in today's systems that we are going to take the data-driven decisions that what is the what has been happened with the past of these kind of patients and what are the symptoms and what are the outcomes of that and how we can cure them. So the early stage diagnosis is very good for the patient, and the system will be intelligently tell the doctor as well that things can be happen with that patient. So the doctor can know before that stage that what is going to be done, or what I have to tell them, that what are the precautions or what are the medicines they can start to utilize to be on the safe side. So this is very important in today's era, and we are also moving toward this in coming 6 to 8 months. Hopefully, we will be implemented that in our system as well. So, is there any question till now, or we are good to go? Okay, so let's move forward. So in the system, a comprehensive HMAS typically include the following modules. So there are the different modules in the HMAS system, which we are going to be covering this presentation, and then I will give you a demonstration of that modules as well in our system, which is implemented in the different government hospitals in the DHQ and DHQs, and in the BHU and RSCs as well. So there is, first of all, the clinical management system. In that, what we have is the patient registration. So whenever the patient is landed into the hospital, so it has to submit there some information to the data entry operator. So this is called the patient registration, and at that time we will collect the data of the patient, that the name, phone number, address, and any sibling or any next to kin person. So this information is collected at this stage. Then in electronic medical record, this is we store the vitals and the things related to that patients in the next stage, which is recorded electronically. And then we move forward the patient to the OPD department, or the IPD department, or the emergency department. So these are the different departments in which the patient is moved then forward. At these stages, the doctor will check up the patient and give the information to the system about the patient and to make it the electronic and medical record. So the doctor consultation is done at this stage. Then the nursing management, the nurse in the IPD or in the emergency module, there is a nursing management system. Or in the OPD, there is no nursing management. So in the nursing management, the nurse will give that medicines or that dosage or the injections to the patients according to the doctor's recommendation. And this is the part for the nursing and operation theater management. This is again the same, that what are the things we are going to use, or the preparations of the patient, and the uh, things which are needed during that operation. It's collective at this stage, intensive care units. So this is again the same way we are treating the okay. Diagnostic services, laboratory information management, radiology management, pharmacy management, blood bank management. So these are the management systems that in the lab landed to the laboratory system. In the laboratory, the patient will go there, pay their fees, and then he or she will be allowed to give their samples into the laboratory, and after that the reports will be generated. And whenever the reports is generated, the message or email goes to that patient. Patient can look into that reports as well, and and then in the next visit, whenever it will come back to the doctor can see that reports on the system as well by the patient MRN number. So this is the laboratory information management system. Radiology management is in the same way. The pharmacy management, the medicine prescribed by the doctor to the patients. uh, it is landed to the pharmacy module, and the patient visit the pharmacy and get their medicine from the pharmacy according to the as prescribed medicine by the doctor. And then the blood bank management, this is again the same. The doctor tells which blood is required and how many bottles is required, what are the things required in that, and or so this is preparation to the blood in the blood bank system, and they prepare that and notify that the blood is arranged and you can collect at this time. So at that time, the person can go there with a small prescription, with a small receiving note, and submit that into the blood bank and collect their blood and give it to the doctor. So these are the diagnostic services which is handled in the HMA system. Then we have the administrative management. So in the administrative management, we have the appointment scheduling. So the patient can schedule appointment with some person in the hospital. So that person is the administrative management part. So they can schedule the appointments of the patients, the queue management. The patients are coming, and so they will be wait. If there is one patient already, then the other have to be wait. So these will make the queue of the patients. And then the bed management, how many beds we have in the hospital, how many patients on the bed, and in the government, in the private sector, there is only one patient on a one bed. But in the government, due to the limitation of the resources, we have allowed to two or three patients in the cases of the emergencies, or in the cases of the disaster, we allow three patients on a one bed. So there are some things, there are some limitations on the government side as well. So, but we have our vision is to give the medication to the patients so that they can cure. And then the ward management system, that how many wards we have in our hospital and how what are the duties in these wards, what are the helpers in this ward, and which doctors are going to perform their duties and this time of duration in the wards. So these things are managed in this module. Then the staff management and the all staff, which duties are assigned and all the things which are related to the staffs. Human resource management, that how we are going to uh, hire the resources from the field, because it is in the any organization, the people come, people leave, or people take leaves. So to manage these things, there should be some human resource department in the organization, so which manage these things, and this module is for them. Then the payroll management system. So the payroll management is that what uh, how many staff we have, what are their salaries, and what are their timings, and if we are going to give them according to timings, so we are going to pay them according to timing. So the system will intelligently tell that when the person check in and when it check out, and on which days he or she was on leave. So the system will calculate their payments, and similarly, the system will tell that what are the shares of the doctor which is signed with the doctors, and how many percentage of that amount is going to be to the doctor. So system will calculate that and show that in the reports. Or if we are going to do that manually, then it is not possible to do all that things manually in a complete organization where 200 or 300 or 100 doctors are working, or there are hundreds of staff are working, and we are going to do each calculation for each person manually. So it is not humanly possible. All right. And then we have the financial management. It is again billing and invoicing, insurance claims, accounts receivable accounts. So insurance claims, there are the things which is related to the insurance of the person. So there is a module in the system as well, uh, by which we can claim. the insurance of the patients on their behalf. To complete the documentation, everything is in that system, and we complete a file uh, to claim the insurance of that person. Inventory and procurement, medical store management, inventory tracking, purchase orders, vendor management, asset management. Then we have the reporting and analysis, executive dashboards. Okay, so in the reporting and analysis, we have different KPIs, we have different dashboards at different levels. So if I am looking for on the Punjab level, if we are talking about the government, so we are handling the Punjab in the health and population department. So at that level, the administration of the Punjab want to look all the district data, all over the Punjab hospitals data, that which hospital is performing well, how many patients load, how many beds there. So these are the, excuse me. So these are the different KPIs by which they can understand that what are the things are required there, and how many doctor or how many staff is there. And for example, if uh, I want to get a list of the hospitals. There is a hospital which have doing the 1500 or 2000 OPD per day, and they have only 10 doctors. And there is another hospital on the another side, which have the 25 doctors and having only 500 OPD. So we will shift that doctors to that other hospitals, so that we can share the load of the patients on the doctors. So these are the different KPIs. I will show you that in the practical demonstration of the system as well. So you can understand these things by that as well. So executive dashboards, there are clinical reports, the financial reports, operational KPIs. We don't have the financial reports in our system yet. We have only one part in our system about the financial, which is related to the labs material. And except that we don't have any financial activity, because in the government everything is free. So we are not going to handle that. Operational KPIs, government reporting, and custom reports. So benefits of HMAS is implementing an HMAS provides numerous benefits, including faster patient registration and reduced waiting times, improved accuracy of the patient records, better coordination between departments. So there is one more thing, that the coordination between the departments. So, for example, a patient is visited at the OPD, and the general physician checked that patient at the first time, and on the follow-up visit, uh, anyone want to say something?
सर ऐसा है कि अभी ना 30 सेकंड के बाद ये जूम लिंक कनेक्शन बंद हो जाएगा, दोबारा इसी लिंक को हम सब ने ज्वाइन करना है सर। थैंक यू।
Okay, thank you.